RAFAB Conversations podcast. This podcast is focused on creating space for important conversations about the development of foster care in Bulgaria. My name is Sarah Todorov, and I'm a postdoctoral research fellow at the University of Birmingham in the UK, where my research for the last few years has focused on the development of foster care in the context of deinstitutionalization in Bulgaria. In this podcast series, I am joined by colleagues who have between them a wide and rich range of experience of foster care and the deinstitutionalization process, spanning the last 20 or more years. These guests include Galina Bissett, founder and CEO of the NGO Equilibrium, Bisa Spirov, Senior Technical Advisor at Lumos, and Evgenia Toneva, researcher and child protection specialist at the Know-How Centre for Alternative Care for Children. In this second episode of the podcast, we discuss examples from the field of the way NGOs and other service providers are practically supporting foster families who care for children with disabilities. We also reflect on the types of services needed for the prevention of separation of children with disabilities from their biological families. Let's get into it. I just wonder if, from any of your experiences, you can speak about some types of support or training that you've seen have been effective models.
Maybe I can say how we support foster families, Hope and Homes for Children, the Bulgaria program. We support foster families that exist and that take on the difficult responsibility of caring for children with disabilities. And they do that because we offer them any possible support that they might need in the process, starting with very practical logistical support, transportation, provision of aids, adaptation of the home. Most of all, we act as mediators because that is the most difficult actually bit in fostering disabled children. We act as mediators between the foster family and the health system, because unfortunately the health system in Bulgaria is quite dysfunctional when it comes to people with disability and children with disabilities. We find consultants, we arrange appointments, we speak with them, we accompany the foster parents to the different clinics and hospitals, and make sure that they are well treated and the children are diagnosed and appropriate treatment is actually prescribed for them. We also act as mediators in relation to the education system, because that's another big blockage to fostering children with disability. Because yes, we do have inclusive education on paper in Bulgaria, but the everyday life of disabled children in the Bulgarian kindergartens and schools is not that easy. Very often foster parents are expected to stay with the children all the time. They're expected to stay with the children in the hospitals all the time. They're expected to transport the children to school or to health services, to the hospital, or to transport the children even to the social service centers, because very often daycare centers do not have transport, or it's not suitable, or they don't pick up children from the villages, but just pick up the children from the town, and so on and so forth. So this very, very practical individual support is actually key to people being able to cope with looking after a child with disability. And of course, they need the training and the emotional support, which is very often provided by the social services in Bulgaria, like the rehabilitation centers, the centers of social support. But for the daily life of people with disability, families who have a disabled child, whether biological or foster, the issues with access, the issues with appropriate aids for the children, the issues with transport, the issues with not receiving the same financial support foster parents as biological parents for looking after a disabled child, the need to go through hoops to upgrade on a regular basis the disability statements for the children, the so-called TELC system in Bulgaria, which is a nightmare for every person with disability. These are the things that foster parents shy away from. But if they have the appropriate support, like the support we have done, accompanying, mediating, reassuring, being there, responding when necessary, they really go for it. And we actually find in our practice that Bulgarians do have a heart for children and children with disabilities. They have a soft spot, and many foster parents would like to take children with disabilities, but they are scared. And if they have the right support, we will not be having this discussion at the moment, and things will be much better, even for the most complex children, babies that are still in the baby homes.
Yeah, I'm completely, and actually, I think Galina described everything very well. I'm afraid that I don't have to add anything new, because really the support, I said before, the support, it seems to be the most important thing. And when I say support, of course, some trainings maybe, but not in a way really to be such like formal trainings. But just some practical things, for example, how to feed the child, again with the idea that it's a child with disability, not disability with child. Again, the focus is different. And I think that really this is the key. If the families agree with Galina that they want to take, there are families who want to take children with disabilities, to take care for them in their families, but they just scared from the system, because sometimes not even from the child so much, but from the system who has to support them, because sometimes it's bureaucratic. It takes a lot of time with all these things that for example, to apply for some suitable supporting aid, shoes, or I don't know, any kind of things, or wheelchair. And again, for me, the key word in foster care is support for the families in all daily in all aspects of the daily life, not just to make one training in 1 year, or to bring together some families on a seminar, or even on some nice activity, but support in daily life, because these children with disabilities, they take a lot of their energy, and any support is very, very important.
So the support that you both described, Galia and Bissa, on a practical level, is very interesting. It's really incredible that families have been supported and continue to be supported to take on children with disabilities. But my guess is that it's not the provision of this kind of support is not present across the country, and that it's in certain areas where there are organisations like Hope and Homes working and other smaller grassroots provision to support these foster families. And I also understand that at a policy level, this kind of support should be existing for foster families, but in some way it's not transferring to practice. And I just wondered, Evgenia, from your experience of evaluating the development of foster care and the establishment of deinstitutionalization of care in Bulgaria, if you've got any comments about the way that we can be moving from what's in policy supposed to be happening, but in practice where there's a gap and we're not seeing that.
Oh, yeah. So in terms of working forms of support for parents that are fostering children with disabilities, I would like to quote, for example, the opportunities for respite care, or the inclusion of foster parents in support groups, often support groups for children, for parents that are with their children with disability, their own biological children. So from my experience as a researcher, I know that these forms of supports are especially valued by foster parents in Bulgaria. But as you said, the problem is that they're not universally present across the country, but rather they have been provided upon request from the foster parents to those organizations which are willing to listen to the needs of the foster parents that they are supporting. And these organizations, and widely speaking, these providers of the foster care service are not that much. And in this sense, I would say that politically speaking, one of the problems is the lack of interest in the experiences of foster parents who take care of children of disabilities. The lack of interest in analyzing this experience and using it to plan further for what is needed for them to actually provide better care and even to stay in the field of fostering, which is quite an issue right now. So this lack of analysis and lack of evaluation of the practices is actually a result of the wider lack of strategic thinking, I would say, in the field of managing foster care in Bulgaria generally.
I also would like to add, if I may, that I think I like all this idea and approach of holistic system, that we can't just separate foster care from the whole reform and whole transformation of the system, relate services for children with disabilities, for others with disabilities, family support services, because it is inevitable all these things interrelates and interreflect each other. I always have understanding that children with disabilities have very important and special role in our societies, because they are something like magnifying glass which shows the problems in the system, which of course are problems and challenges for other children which are not with disabilities. Because when we see what's happened with a child in foster family or in the family, one of the big problem is this lack of support, which also mean lack of services, these universal services. Again, not to repeat Gala, but inclusive education, health, access to health services. If they are functioning better, this will be very, very important support, not only for foster families, but for families for children with disabilities. And maybe there will not be a big percentage of abandoned children with disabilities from their own families. The prevention will be the prevention is provision of these universal services, not only some specific services. And I think that this is really something which development of the services has to be something of something like cornerstone on the politicians and all the strategies for development of any more specific type for children with disabilities or any kind of vulnerable children. It doesn't matter if we are talking for foster families or we are talking for family support services or any other, or for children with delinquency or very difficult and challenging behavior. And this is something which still, I think we all participated in this big discussion and working group regarding the new law for social services, which is not new already few years is implementing in the practice. But I think that still in this field, Bulgaria and all the professionals, the systems has to think about how to provide the services which really support children to stay in the family and in the community. But this means that this is also support for the families to take care for their children. Because actually this is really part of the UN Convention for the Rights of the Children, that the parents are responsible for children and they have to take good care, but the government, the state, has to support parents. And these services has to really to be accessible for children with disabilities as much as possible, because this is really very big support for families, foster families, and biological families.
Yeah, it strikes me, Bisa, that as we're discussing these issues and we're talking about them in the context of foster care, because unfortunately the reality is that in the social service system in Bulgaria, who are separated already from parental care, and there continues to be children separated. So foster care has a really big need for development. But at the same time, a lot of the things that we're talking about, I think, are not only relevant for foster families. The need for developing support in the community at local levels is also for biological families. And a lot of these, there's a lot of commonalities between, okay, how do we keep children with their biological family? And the same kinds of support may be needed for biological families to keep their children as for foster parents to be able to look after children who are already separated or unable to stay with their families or in the process of being reintegrated. I wonder if anybody else has any comments about that.
I don't know whether it is surprising, but it's quite fascinating how similar the experiences of biological parents of children with disabilities and the experiences of parents who are fostering children with disabilities are. I mean, they share that much. And the challenges, the everyday struggles, the skills that they develop, the very way they look at the world around them from the perspective of someone who is taking care of a child that is so much dependent and reliant on her or him is really very important. So that is why I said as a good example of support practice, that support group or that mix up, let's say these two type of parents are very, very successful and very valuable for parents in Bulgaria.
Thank you for watching or listening to this second episode of the RAFAB Conversations podcast. Stay tuned for the next episode where we discuss the way foster families are perceived in the Bulgarian context and what needs to be done to address their misrepresentation in public and professional spheres. We hope you'll join us again next time.